line, this midpoint over here, then we know that you are capable of donating blood, and we can quickly send you to the blood donation room, and the phlebotomist can help draw your blood, take a little pint of your blood from there. So we use this as a screening test, and specific gravity, it can increase if you concentrate your blood, hemoconcentration. How do you do that? Well, dehydration. So dehydration causes your specific gravity to increase. Dehydration increases specific gravity of blood. But things that lower specific gravity, remember, is anemia. Anemia causes reduced specific gravity of blood, because less hemoglobin, less density, so naturally less specific gravity. Dehydration increases specific gravity. Why? Well, remember these fluid compartments we were talking about over here, up here? Yeah, when your body is losing water from the epithelial surfaces, you're exhaling, lots of moisture goes out, you urinate a lot, and you're not replenishing your fluids over there, then what's going to happen is the cells need water to function properly. All these organelles in the cytoplasm need it. So these cells start to drink their own extracellular fluid. The extracellular fluid compartment shrinks. The interstitial fluid cells get drawn into the cells, and eventually the plasma is also going to get drawn into the cells. This is going to reduce your blood volume, and it's going to cause you to get very, very thirsty, but also concentrate your blood. Alright, so that's how you get an increase in the specific gravity of blood. Another interesting thing is how pregnancy can affect specific gravity of blood. So when a person gets pregnant, so remember this diagram I showed you over here, where this is your blood, these are the cells, and the cells constitute 40 to 45% of your red cell mass. Usually in females it's 40%, right, in females. So females get pregnant, so here we go, we have 40% females, 40% hematocrit in females, and these are going to, this is your red cell mass, and this is plasma. When a woman gets pregnant, her body goes through many changes. This includes the vascular compartments. So what happens is, you see your red cell mass, it's going to increase by 20%. There is going to be an extra 20% increase in your hematocrit, or packed cell volume. Okay, but the plasma also is going to increase by 40%, not 20%, 40% increase in plasma volume. So what's going to happen is, you will have more red cells and more hemoglobin in the system, but because the plasma has expanded even more, this is going to cause your red cells to appear lesser in number, because they're diluted more. This is called the relative hemodilution. Relative hemodilution seen in pregnancy. So what happens when you're pregnant? Your body needs more oxygen to go to the new tissue that's growing in your body, which is the baby. So the fetus that's growing, the baby that's growing in the womb, is going to need a lot of oxygen. So the mother is going to have more red cells. But also, to hold those red cells, you need to increase the plasma. Well, the plasma increases double the amount that the red cells have increased. So the red cell volume increases by 20%. The plasma volume increases by 40%. So this gives you your relative hemodilution, and that makes your hemoglobin concentration in the blood actually go down, but actually you have a decent amount of blood. So those numbers and cutoffs for hemoglobin concentration in pregnancy are quite different than from adults. Let's talk about hemoglobin concentration now. So about hemoglobin. We'll just talk about this very important constituent of your red cells. It's the reason your red cells exist. Hemoglobin is a molecule, and we'll have a separate lecture on hemoglobin in detail. So this is just the introduction. So here's what happens. Hemoglobin is a very important molecule. It's got four hemes over here. It's got this tetrapyral structure. Okay, tetrapyral structure. So you have four of these hemes, tetrapyral structure, one more over here, and we have iron inside here in the middle. So the tetrapyral structure, porphyrin ring it's also known as, with iron inside. Okay, and this is bound, this is the heme which is bound, which is in association with one big chain called globin. So it's got its globin chain around it like this. Okay, so there are four hemes and four globins in a hemoglobin molecule. It's a very big molecule, around 62,000 atomic mass units roughly. Now this hemoglobin is what binds to oxygen with the iron. The iron binds to the oxygen in a non-covalent fashion, and CO2 binds to these globin chains, to the end of the globin chain. So you have this amino group. Every protein has got a COOH and then an NH3 amino group over there. Yes, carbon dioxide binds to this amino group. The terminal amino acid is valine over here, and CO2 likes to bind to it. So it plays a role in gas exchange and also in buffering blood. So you see these amino acids, they have the ability to take up extra hydrogen ions, or even to give hydrogen ions when the pH changes in the opposite direction. So it helps in maintaining the pH of our blood. It's a very effective buffer system that exists, one of the major buffer systems that exists. And hemoglobin is a very viscous molecule, and your hemoglobin is, for that reason, not left free in the circulation just to float around as it pleases. Because one thing, if hemoglobin was left free to float in your blood like this, just floating around, your blood would become very, very, very viscous. So it's very viscous. That would make your blood very thick. And who's pumping the blood? The heart. So if you make everything viscous and sticky, the heart is going to have a hard time pumping that blood forward, and it can cause heart failure. So to prevent heart failure, we bag these hemoglobins in these cells called RBCs. That is why you have your hemoglobins. That's around 33% of your RBC cytoplasmic volume is going to be filled with hemoglobin. So you have the hemoglobin, which is a buffer, which binds to CO2, which binds to O2, which helps in the transport of these different gases. Of course, CO2, this is not the only way CO2 is transported. There are other ways CO2 is transported. There are two other forms. We'll be speaking about that in its respective class. Now, viscous, so very thick. We can't have it floating around, so we keep it in the red cells. This makes our blood not so thick and our heart not so dangerous. And if we left hemoglobin free, this iron, it can just get free from the hemoglobin, and it can start making free radicals. Okay, and that is not good. So free metals, heavy metals that are floating in the blood or in any fluid compartment is never a good idea, whether it's ICF or ECF. It doesn't matter, because they make free radicals. So this is by a reaction called the Fenton reaction. Fenton reaction. It takes it creates hydroxide, it creates H2O2, it creates superoxide. So these are the different free radicals that damage different molecules in your cells and organelles in your cells, causing aging to take place. So for that reason, we have our hemoglobin kept safely in these cells over here. And we'll discuss about situations where cells are destroyed and the hemoglobin is released. For example, mismatched blood transfusion or hemolytic anemias, where the body decides to destroy its own cells, or the cells are destroyed even by various parasitic organisms or antibodies which are produced against it. So these can damage the red cells, releasing hemoglobin, and they have a lot of effects, and we'll have a chat on what those are again. So your hemoglobin concentration in the blood, you should know these values very well. It's different in males and it's different in females. The average male is got around 14 to 16 to 18 grams per deciliter, grams per 100 ml of blood, grams per deciliter. Females have around 12 to 16 grams per deciliter. Okay, so you could say 16 plus minus 2 grams per deciliter here, 14 plus minus 2 grams per deciliter. This is for people who are at sea level. Sea level. You should understand this. Why? Because when you live on mountains, the air up in the mountain is thinner than the air at sea level when you are living at high altitude place. So at sea level you have nice concentration of air, 1 atmosphere pressure of air. Okay, but on the mountains it can be lesser air pressure. So lesser air pressure means lesser partial pressure of oxygen. The pressure of oxygen, partial pressure of oxygen going into your lungs and making it into your blood will be much lesser compared to at sea level. So people are more comfortable at sea level than in the mountains. So people who are living in the mountains secrete some hormone that helps in making more red cells. That hormone is called erythropoietin. I'll be talking about it in great detail real soon now. Erythropoietin. Because it needs the oxygen. The body needs more oxygen, so they make more cells, and this hormone called erythropoietin, made from the kidneys, 85% in the kidneys and 15% in the liver, is going to help increase the red cell count. Okay, so people in the mountains might, if you go up in the mountains, your hemoglobin levels might change, provided you eat properly and eat appropriately for that environment. It will increase your red cell count. Okay, so I'll be speaking about blood doping and doping using erythropoietin, EPO, and a very interesting topic also to talk about when we reach there. So these values are usually for the sea level, and if you have lesser than this, the hemoglobin lesser than this, you may have anemia. Okay, you may have anemia. Anemia is a reduced red cell mass. Anemia is reduced red cell mass. This definition is very important. Red cell mass in the vascular tree. And because you have reduced red cell mass, remember, this is your blood vessel, the representation. 40% of it is cells, 40 to 40, the remaining is plasma, we know that. Now if you remove some of this, what's going to happen? You're going to have reduced red cell mass in the vascular tree. And this anemia happens because you've reduced this mass over here. And it may be reflected by, may show up as, may be reflected by, reflected by reduced hemoglobin concentration and slash or, mean with or maybe even without reduced RBC count. I'll explain this. These words have very important implications, and I'll explain it in more detail when we go to anemia. Right? For now, remember these numbers. Right? Mostly men who have less than 13.5 grams per deciliter of hemoglobin, they are said to be anemic. And for women, we have, you can reduce the number just a little more. So if a person has less than 13.5 grams per deciliter for men, and for women, if it is less than females, Some books say if it is less than 11.5 grams per deciliter, you can say that they're anemic. Of course, it varies with the altitude you are in, and this one, it's a little, this one. We'll talk about it when we go to anemia. There are situations when a woman is pregnant and when she's not pregnant, whether she's anemic or not. Make sure that your females all have hemoglobin around 11 grams per, around about 12 grams per deciliter, and they should be okay. Okay, so that is our small discussion and introduction to blood. Next we'll be talking about the red cell, the red blood cell in detail, and about the hemoglobin and plasma proteins in much more detail.